Nabil, can you see me?
Actually I can, not too bad. Can you see the camera, Zoe?
Can't really, but that's because I have really bad astig. And also I'm a little bit short-sighted, long-sighted. I'm nearsighted or far-sighted. I'm not even sure. I just know
I have the older people disease one, the nearsighted.
Nearsighted, so you can't see things nearby. So I can't see when things are too far away.
So we should, like, maybe I should take your left eye, I should take my right eye, so that our sight will be better.
Maybe.
But maybe you don't have to do that. Maybe you can just listen to this discussion that we're going to have. We do have an ophthalmologist in the studio with us. Let's introduce Dr. Tara Mary George, who has very beautiful eyes, actually.
Oh, thank you.
Yeah. First of all, Dr. Tara, obviously this is something that not really discussed between people. I mean, I know that I get a lot of scoldings from my parents for watching TV a bit too closely when I was a child, but that's pretty much it. If we want to say eye diseases among Malaysians, which one do you think is the most prevalent one?
What you were talking about is called refractive error, short-sighted, long-sighted, astigmatism. That you wouldn't call that a disease. That's just due to the shape of the eye, and it's corrected with glasses. That's the most common.
It's more of a condition?
It's just you wouldn't call it a disease. Disease, you have to give some medical treatment. This one, you wear glasses or contact lens, and it's corrected.
So it's just a condition.
Yes,
right? Okay,
that's right. So you have very common things like dry eyes, okay? That is not dangerous. Then you move on to things like cataract, very common as you get older. Then you have the more serious issues where you can lose vision, things like glaucoma and any disease that affects the retina. Retina is like the nerve layer of the eye, and that's the part that focuses. So if you have something wrong in the retina, you need to address it quickly. If not, you can lose sight permanently.
Okay. So what are the other vision disabilities that, is, I would say, not commonly discussed between Malaysians itself? Because whenever we think about, hey, I'm losing my vision, immediately it's automatic, oh, I'm going to go blind. But that's not necessarily the case as well. And even blindness itself has different degrees of blindness, right, to my understanding. So can you explain to our audience what are some of the vision disabilities that is not really commonly discussed?
I think retinal diseases are not commonly discussed. Everybody knows about cataract. And that is the problem, because when they have a problem, an older person, they immediately think, oh, I may have a cataract, I can wait. It's not serious. A younger person may think that, oh, it's just that I need glasses, and they may wait. Okay, so unfortunately for the eye, you can't really rely on your symptom. You have to have someone look at it. Either your optometrist, who can do the initial examination. It's easy to go to an optometrist, or even an eye doctor. Now, there's no need to panic, but there are certain symptoms that are more prominent that you would want urgent attention. Certain are not so important, like if you just have some itchy eyes, some burning sensation, that's usually not so serious. But if you start seeing things looking crooked or distorted, or you get a little patch in your vision, or you have a lot of dark floating spots in your eye, now that's something more serious. So we can't generalize everything, but in fact, people are more worried when their eyes are hurting, like burning or stinging, but actually that's less serious than seeing a patch in your vision. That's more serious because different parts of the eye are affected.
Talking about something serious, as we can see from the screen just now, there was two diagrams of normal eye and diabetic eye just now. And we are going to talk about a bit of that because apparently your eye condition can get worse if you have diabetes, and that's not something I would never, relate these two together. So maybe it's something that you can talk about, especially because I have lost an aunt due to diabetes, but I don't remember her having any vision problems. So maybe you could explain a bit about that.
So that's a really good point. You're just like many of my patients or many Malaysians who are not aware that diabetes can cause vision loss.
Wow.
And they're not aware that diabetic patients need to check their eye regularly, even though they feel their vision is perfect.
Right.
So that's actually the take-home message. Diabetes can make you lose vision. You may feel your vision is perfectly fine, and one day suddenly you can't see. So that's what we want to avoid. Now, how this happens is diabetes actually affects blood vessels all around the body. Now, the eye is actually the window to your body. Now, we have many young people. Nowadays, a lot of young people have diabetics. You know, you don't have to wait till you're 40 or 50. So, in fact, the Malaysian survey shows that almost 1 in 5 of those above 20, when they checked, had some high blood sugar. You know, it's our wonderful Malaysian food. But even young people or older people, if the sugar is high, it damages the blood vessels of the eye. The blood vessels start leaking or start bleeding, and that's how they lose vision. So even any diabetic patient, okay, needs to have their eyes screened. And that's actually guidelines that have come out by the Ministry of Health and even worldwide. At least once a year, you have to get your eyes checked.
Well, I'm due for an appointment then. I would say I'm definitely due for an appointment.
Or maybe just cut down on those teh tarik, Zoe.
Yes, definitely cutting down on the sugary drinks, sugary food, and whatnot. But that's not enough, actually, right? I want to go into the myth of all this, since we're talking about food a little bit. So when I was a lot younger, I think the most common myth is that, hey, you should eat more carrots because it's good for your eyes.
I heard too.
Right? You've heard it as well, right?
Yeah.
So is that true? Is that not? Let's, if parents are still doing it, I'm not sure.
It's not just carrots, okay? So healthy lifestyle promotes good eye health, which starts from childhood. Carrots are one of the things. It's actually multicolored fruits and vegetables.
Oh, okay.
They have things, vitamin A is in carrots, then you have vitamin C, you have lutein, which is all in your green leafy vegetables. So basically, eat more vegetables, eat more fish. Those are good for your eyes. But of course, diabetes is a different issue altogether, but what you're talking about is general eye health. So not just carrots, but lots of vegetables and fruits.
All right. Nabil, eat more vegetables and fruits.
I will eat more fishes. We'll go to more sushi places after this. Of course, we were talking about diabetes just now, but of course, when it comes to the eyes, there are a lot of other conditions that, things that can happen to your eyes, basically. Maybe you can tell us a bit about how do these eye conditions or eye diseases started? Is it a genetic thing, or is it maybe a part of your lifestyle? And maybe if there are any symptoms that come around before it gets worse, maybe you can tell that to the audience also.
Okay. So you have inherited diseases, like you're talking about genetics. That's not very common. It's rare, but it is. It does cause vision loss. That is a whole separate entity which people are doing research on. Okay, we don't have many answers for that, but it will come up in the future.
Sure.
Diabetes is something we have the answers for. When someone has diabetes, you have two aspects to the management of the eye problem so that they don't lose vision. Firstly, they must have good control of the medical risk factors. So, a lot of our Malaysians, when I ask them, they say, oh, saya just buying medicine from the pharmacy, but not seeing anybody, not seeing the doctor. So there's this myth that as long as I'm popping a pill, my diabetes is well controlled. But unfortunately, that's not true. So you do have to see your GP or clinic kesihatan or anyone, so at least they keep it under monitoring. So if you have good diabetic control, usually you will not get this problem in the eye. Okay. Now, the problem is a lot of us have poor control, right? Just eating the medicine is not enough. So the sugar levels might be very high, and when that happens, these problems happen in the retina, the nerve layer. Now, as I said again, you can have perfect vision and still have problems in the eye because it may not have reached an advanced stage yet. You want to pick it up when it's an early stage, okay? We call it a mild stage, because if you control the blood sugar well at that stage, it won't progress. So you can have no problems right till the end of your life. There are many people who have good control of diabetes who have no problems till the end of their life. However, the symptoms to look out for, say you don't go for a screening, is if you have blurring in the center, so they find difficulty in reading even with glasses, or they have distorted vision, things look crooked, okay? They actually see things wavy, or there's a patch, they feel something is blocking, they wipe their glasses, the thing is still there. Those are all symptoms that you need to be aware of, and you need to see a doctor.
What are the treatments for this, though? Once you have identified, hey, I have maybe an audience who are thinking right now, watching, they're like, hey, I do see patches, I do see a little bit of blurriness, even when I'm wearing my glasses. And I think majority of Malaysians, any doctor we have spoken to, a lot of them are afraid to actually take treatments because it could be expensive. You know, they are just generally very scared of the downtime and whatnot. So can you just explain to our audience, once they have identified the problem, how to treat it?
Yeah. So if you have been diagnosed to have retinopathy that is affecting your vision, so we call it sight-threatening. That means if you don't do anything, you lose your vision, okay? The treatments that are available either is laser or injections of medication into the eye. Now that sounds really scary.
It does.
But whenever you look at something, you look at the benefit and you look at the risks. The benefits far outweigh the risks, so we advise it, right? There's a lot of benefit from getting this treatment. You keep your vision for a long time. Now, people get scared. They think they see a needle coming straight into their eye. It's not like that. You don't see a needle coming in your eye. The needle is very fine as your hair. Okay, and the amount of medication that's injected is very small. It's under anesthetic, and once it's more of anxiety rather than pain. Once they go through the first treatment, the injection, they are quite happy to continue because they see the benefit. Their vision improves, and they do continue the treatment.
I just have one question. I guess if you have started having the symptoms, you see there's something blocking your vision.
Yeah.
How scared should you be? I mean, what are the risk factors? Will treatment make these patches go away completely? Is it something treatable?
Yeah, so that patch that happened in the eye did not happen overnight. It would have taken a few years. I told you, you can feel your vision is normal, but the damage is already started. So it takes years for the damage to start, and it will take a long time before everything stabilizes, even when we treat you. So usually we tell our diabetic patients, as you undergo treatment, it may take about 1 to 1.5 years before everything stabilizes. And of course, that's provided your sugar is well controlled.
Oh my.
Right. So it has to come hand in hand. The minute that you get the treatment, you go for surgery, and then after that you have to make sure, ladies and gentlemen, take care of your sugar levels. Just because you went towards a treatment, you've done the surgery, does not mean it's an instant cure, right?
Yes.
So one and a half years, you say? What happens if the patient does not recover within this 1.5 years?
So it depends when they presented. Yeah, so that's why we do all these kind of public awareness. We want people to come in early. We want them to get screened. We want these conditions to be picked up early, because the earlier we treat them, the better the outcome. Those people who don't do well are usually those who come at a more advanced stage. So even though we can help them, they will not get back to normal. But if you pick it up at a very early stage and everything is well controlled, they actually can lead a normal life after that with good vision.
All right.
Maybe it's good to hear this, especially about the sugar levels, because I do eat. I am definitely a sweet tooth. So maybe we should stop that segment in our show. No, I'm kidding.
No, maybe perhaps we'll send other, we'll rotate our host for a sweeter segment. So I want to know, before we actually end our show here today, in terms of the screening, is it the way forward for us to detect our early problems?
Yes.
Let's say, what if I don't have problems like diabetic, but I'm not necessarily diabetic, but I love having sugar. So would that also impact, would that also contribute to this, or?
No, not really. You have to have high blood sugar. So the first step is get blood sugar checked. You can just go to a pharmacy and check your blood sugar. You don't have to be above 40 to check your blood sugar. Screening for the eye. People think that eye examination is so complicated. You sit and then they put drops in your eye and it gets blurry, but it's not like that anymore. We have new cameras that can take photos of the entire retina, and within 5 minutes you're able to see what's going on. And that's available in the the government as well as the private sectors, a clinic kesihatan, private hospitals. So it's a very quick examination. You don't have to spend the whole day in the hospital, and we are able to see what's happening in the retina. So that's the way forward. In fact, AI will come forward. The AI will grade your photo and give you a reading. That's the way forward. Okay.
Wow.
So it's not complicated anymore to have your eyes screened.
Yes.
You do not have to wait for hours in a specialist clinic. Many places have these screening cameras, and please get your eyes checked if you have diabetes, or anyone. Anyone can go for an eye screening. They may pick up other things and advise you accordingly.
Yes, anyone indeed. And it's nice to hear that you mentioned clinic kesihatan twice, actually, because I think when people think about eye treatments, they are thinking about the big hospital, the private hospitals, it's going to cost thousands. So, I mean, of course, that's way into the future, but what you should do first, if there's any condition or symptom, just go to the clinic kesihatan first. If you can't afford the private clinics, just get it checked first and see what is the condition of your eyes. So maybe before we close the show, actually, thank you so much for having us, but maybe some takeaway message. I know you mentioned something about diabetes already, you can mention that again. And maybe for the young parents who have young children, how should the children take care of their eyes?
Okay, so first for diabetics, at least once a year, get your eyes checked. I've said it's simple, it doesn't have to be complicated. For children, actually, short-sightedness, a major study has found that playing outdoors for 1 hour a day can actually reduce your short-sightedness.
Just 1 hour?
Oh, wow.
1 hour every day playing outdoors. Okay, so that's why...
At a reasonable hour, right?
1 hour. So it's like, I mean, it doesn't have to be 1 hour at a stretch. That's why you see the rural children are not wearing thick glasses. Of course, not anymore, but it used to be that way compared to the urban children. So that's a take-home message. Let your children play.
There we have it, ladies and gentlemen. I know, the Gen Z, Gen Alpha right now, most of the kids now are stuck to their tablets, stuck to their mobile phones, but, outdoors, go out, okay? Go and see the sky, go and play, go and make some friends. It's good for your health, good for your overall health, So ladies and gentlemen, go and get your eye screen done. I'm actually going to make an appointment right now, right after this show. You're going to follow me, right, Nabil?
I will, and I also will remind us to not go get the cakes and the brownies anymore after this, because I have been going out to play when I was a child. I mean, sometimes up to hours to end. But you know what? I still have short-sightedness, so I think it's the sugar level, Zoe. And now I definitely have another thing to think about when I'm consuming all those desserts.